On Tuesday, January 19th, vaccinations will be available to those who are 80 years of age and older. We will start with our most vulnerable, where we've seen the most tragedy, the people in this state who have the most risk of death if they get the COVID. That is people in the general population, not people in nursing homes. We're already working that through. But people who are 80 years of age and older. We believe that those individuals are somewhere in the neighborhood of 420, 450,000. We are also, as I indicated last time, receiving about 100,000 for those several weeks, doses per week. So obviously not everyone who's 80 is going to be able to get it that week, but we wanted to set aside 1 week where nobody else could get it except based on age, except those 80 years of age or older. Those receiving vaccines will receive them from, in some cases, physicians, from local health departments, hospitals, federally qualified health centers, in-home health service providers, as well as some of our retail pharmacies. Now, the Department of Health has approximately 1,700 providers already registered to distribute vaccines and will add more. However, when we go to the date of January 19th, not all of these providers will have the vaccine. What we have to do is distribute it through 88 counties. We have to do it in an efficient way. We want to make it accessible, but we also want to make sure it gets out very, very quickly. So as we move forward, there will be additional ones that will be added. But the first, I'll tell you in a moment about the first week. So this coming Monday, we will hold a webinar for registered providers. That will outline our expectations and our instructions for distribution. On Tuesday, those who have been selected to deliver vaccinations the first week will be notified. And they will know on Tuesday that they have been selected to administer these drugs, this vaccination the first week. And they will receive information about the size of their allocation. Now, as I said, there are more providers registered than will initially receive vaccinations, but we will add providers as more vaccine comes available. Again, what drives so much of this is a scarcity of the vaccine. So 100,000 is roughly what we think we'll have for this group the first week. Let me continue on the week. On Wednesday and Thursday, we are asking local emergency management agencies in every county of the state to hold a press conference announcing where vaccinations will be available in their counties and how individuals can receive them. Some providers may require appointments. Some may hold drive-up clinics we can drive through. Some may have walk-in, walk-up clinics. So some you'll have to make reservations for or schedule, some you will not. We expect every provider to clearly state how they will administer vaccinations to eligible individuals. Further, on Thursday, we will launch an online tool on coronavirus.ohio.gov, where individuals will be able to see who is distributing vaccinations in their counties to what eligible group. And the first week will be those 80 years of age or older. Again, as more vaccinations are available, more providers will be added. So how can you find out about this? You'll see it in your local news media. TV, radio, newspapers will provide that information. You will also be able to look on the webpage of the state and look that up as well. So there'll be opportunity for people to be able to see where it is in your county. Now, vaccines are usually delivered from the manufacturer on Monday, Tuesday, and Wednesday of each week. Sometimes there has been a day delay. We cannot control that, nor can the provider control that. We anticipate those providers that receive their vaccines on Monday, January 18th, will in all likelihood start distributing on Tuesday. Those that receive them on Tuesday will begin to be distributed on Wednesday. And those received on Wednesday, we anticipate will be administered beginning on Thursday. So again, that's information that the provider will know. They will know what day they're scheduled to get it. They'll know how much they're supposed to get. And assuming they get it on that day, they will be able to proceed the next day to vaccinate people. But the instructions of how to do that will come directly from that provider, whether it's a health department or whether it's a retail pharmacy or whoever that might be. So clearly, with up to 420,000 people or so, 80 years of age and older, and with only 100,000 doses available for the first week, it will take a number of weeks before those 80 years of age will be able to get their vaccine. Now, every week after that is our plan, and we'll have to see how this goes, and we'll have to see how the distribution goes. But the plan is, and again, it will depend on how much vaccine is coming in to the state of Ohio, which we do not control. We think we know how much is coming in, but we cannot control that. So each week we will add 5 years. So on January 25th, we anticipate vaccinations will open up to those 75 years of age and older. So the 80-year group will still be able to get it. Now we'll go down to 75. Anybody 75 and older, that week will phase that in. The following week, it will open up to people 70 and older. And February 8th, the vaccinations, we hope, will be able to be available to those 65 years of age and older. Now, again, this is going to take some time. The whole group of 1B is about 2.2 million. So when a new age range opens, that just certainly does not mean that vaccinations will be completed for the previous age group. We know they will not. Again, it will take a number of weeks to distribute all the vaccine given the limited doses available. We hope that the number of vaccines coming into Ohio will increase. The week of January 25th, vaccinations will be available to those with severe congenital, developmental, or early onset medical disorders. We will announce in the coming days how those individuals will be able to receive their vaccination if they choose. So we're not announcing that today, but we will. And we will announce how they will know when they will be able to get the vaccination.